Hey guys, it's Dr. Roach coming back again. Hope you guys are having a good 2021. So today I'm going to talk about how can I tell if my child has COVID-19, what's the process to go, and then what's next, right? So basically today's video is just talking about COVID-19 and what to do with your kids, okay? So first things first, if you're watching this video and your kid is turning blue, they are confused, you cannot wake them up, they are not acting themselves, they have pain in their chest, they are confused, I need you to hang up this video, whatever to do, get rid of this video, call 911, okay? So I need you to go to the emergency department, okay? So if you're having any of those symptoms, I do not need you to be on YouTube looking what to do, okay? So basically, we get asked this question a lot, like, what do I do? Like, how do I know if my kid has it, right? So one, those are the emergency conditions, okay? So any of those things I just said, go to the ER, the emergency department right now, okay? Call EMS, okay? So now I'm going to talk about if your kid doesn't have any of those symptoms. So how do I know if they have COVID? So this has been an interesting 2020, 2021. You would have never thought that we'd be wearing masks and goggles 24/7, right? But it's actually helped prevent a lot of flu. Like, I can't wait to see our numbers this summer to see how much flu has come down, which I think has really helped because we have had good hand hygiene, which we've been saying that since probably the 1700s in medicine. So good hand hygiene and wearing your mask. So wearing that mask isn't necessarily that it is protecting. The mask is basically protecting the secretion. So we spit more than we think. We cough, we sneeze, all those secretions go in the air, right? So when you're wearing a mask, basically you're keeping them confined to yourself. Here's my plug to don't forget to change out your mask and don't forget to wash your mask. I am definitely bad at washing my mask because I hate washing them because then they shrink and then they become kid size and I can't wear them anymore. So I hate getting a new mask and then I have to wash it. But you do have to kind of wash your mask kind of like you're washing your clothes, right? So I definitely say the mask has helped with that. And then social distancing. So we're not touching each other as much, which I'm not a hugger. I don't necessarily miss hugging at all. But I did shake my hand with every patient when I went in the room. So that was a hard habit for me to break with COVID. That took probably like 2 months of me not shaking hands to actually break that habit. So that's one thing. So I do think that's why we've seen a lot of decrease of flu and other viruses. But COVID is a virus. So COVID-19 is a coronavirus. So it is a virus. So basically it has a lot of the same symptoms as other viruses. So kids have definitely had, and I am a pediatrician. If you guys didn't know, I'm Dr. Roach. I'm a pediatrician down here in Danville, Virginia. So just in case you've never seen a video before, don't forget to like and subscribe. But kids have a little bit different symptoms than adults. So a lot of times, especially now, you're hearing a lot about, you were hearing more about you had to have fever, you had to have a cough at the beginning, like last March. Now you're hearing loss of taste, loss of smell, and stuff like that in adults. And I can say kids have not had all those same symptoms. So kids have definitely had mild to no symptoms more compared to adults, but it doesn't mean they don't have COVID-19. So kids can still have fever, they can have cough, they can have chills, they have congestion, they can have sore throat, they can have nausea, vomiting, diarrhea, they can be tired, they can have headaches, they can have poor appetite, feeding, they can also have cough. So basically they can have any symptom, but those are basically the most common symptoms we're seeing right now. These symptoms today, my resource is cdc.gov. Definitely should always check it out if you guys have questions. There's always information for providers. There's always information for different healthcare providers, no matter what your level is, as well as patients and families. There's always information out there. So what do you do? So you think your kid has some of these symptoms. What do you do next, right? So the first thing is keep them home, okay? So if your kid has some of these symptoms, please don't go to the grocery store. Please don't go send them to school. Please don't go to the library. You know, keep them home. And then call your primary care provider. So call your pediatrician. Call your local doctor and see what's the next step. So Most clinics now are not doing walk-ins just to kind of prevent that exposure. So having somebody sick with all these symptoms, I just went in, sitting in a waiting area for 20 minutes, that I just exposed the whole waiting area. So we're basically, a lot of clinics are doing like wells in the morning, 6 in the afternoon. And then that way you can deep clean the clinic in the afternoon. That's how a lot of clinics are doing, and most clinics aren't doing kind of walk-ins anymore to kind of prevent that. So there have been some benefits of COVID-19 as far as how we kind of work things out, right? So that's one thing. Stay at home, calling your provider. Third thing is protect yourself. So don't forget about hand hygiene and washing your hands and wearing a mask. And because if you have other kids, you have other family members, maybe you take care of your parents and stuff like that. So you don't want to expose everybody. So, and then maybe you still have to go to work. Good hand hygiene, wearing a mask, stuff like that. Those are all helpful things as far as what you should do next. And then the last thing, kind of review the policies, notify the school, notify daycare, and kind of see what is the next protocol. So if my kid has a fever, or they have a new onset cough, or if they have a new onset headache and a fever, of course, I've contacted my doctor. They've told me what we're going to do. And then making sure I tell school that, hey, this is what's going on. And then they might have their own policy. So I'm in Virginia right now. So the state of Virginia definitely has different policies for when you go back to daycare, when you go back to school, depending on if you have a COVID test, depending on if you meet criteria. And there's different protocols that's available through the Virginia Department of Health. So the VDH. So there's different things that's available. So definitely, and they're available for anybody to see. So you can definitely check those out. But those are kind of the 4 big steps that you should do. So keeping them home, calling their pediatrician, their primary care provider, protecting yourself, having good hand hygiene, caring for yourself, because you have to care for yourself to be able to care for your kids, right? And then last, notifying the school, daycare, reviewing the policies for your job or anything like that. So hopefully this was helpful. I talked about kind of what you should do, what you should look for. If your kid has COVID-19, what should be your next steps. And hopefully this is helpful. So have a good one.